Hi, my name is Kaylin, and I'm here to talk to you today about the ethical argument of euthanasia. Euthanasia is not only a problem in the United States, it is an international problem. People can have different ethics and different morals that have been instilled in us since before we were born, or even growing up through our parents, through social interactions, cultural interactions, everything. Personally, I am pro-euthanasia, but there's a gray area. When is it right and when is it wrong? And that's when the normative theory comes in. The normative theory defends if a decision is right or wrong or just. Euthanasia is very, very strict on the rules. And by euthanasia, it's not allowed in the United States. It's physician-assisted suicide. But in other countries, yes, they do euthanize people. And honestly, I see no problem with it. If you were a cancer patient, or if at one time in sound mind you elected to be euthanized and you got Alzheimer's. I have first-hand witnessed a family member dying of Alzheimer's. It was not pretty. It was not fun for anybody involved. She was suffering. We were all suffering. Had that been a choice, I honestly think our family would have chosen to have that happen to her. But with those rules in place, no one can just come in and be like, oh, hi, I don't want to live anymore, I want to be euthanized. There needs to be rules. And that's not great. That's the gray area that is being talked about. Is it right? In some cases. Is it wrong? In some cases. The just part and the ethical part is not a one-size-fits-all. The ethical argument is a case-by-case decision. It's a very slippery slope. You start out with cancer patients, Alzheimer's patients, newborns, infants that will only know pain, elderly people, and people suggest palliative care, but palliative care just prolongs the suffering sometimes. Sometimes it's best just to let them go, and it's better to let them go on their own terms. People have the right to choose between coffee and tea every day. They have the right to choose between oatmeal and cereal. Why aren't people given the decision or the choice to make the decision to end their suffering on their own terms, or to wait it out and let nature take its course? Ethics is not one size fits all. There's always going to be gray areas. What I think and what you think may not be what the society standards are. But at the end of the day, if you can agree with something and you can sleep well knowing you agree with it, then you should have no problem being a good, ethical human.